Says, dear colleagues, it's a great pleasure and a privilege for me to say a few words about a more positive message about the future. I'm a medical doctor. I trained as a medical doctor for many years, been concerned about the effects of climate change on human health, the essentially catastrophic effects. But what I want to talk about today is the other side of that coin, which is the health benefits of moving rapidly towards a net zero future, both in terms of adaptation and mitigation. And I'm going to focus particularly on some of the work we've been doing through this commission, which is co-chaired by Joy Fumafi and Helen Clark, who you will know, no doubt, which is about developing better evidence to direct us towards a healthy net zero future. And as we've already heard, Jos presented the works on air pollution from fossil fuel burning. There are big potential health benefits, and these are in addition to the benefits of preventing dangerous climate change. They're also quite near term, so they occur over coming years and sometimes decades as well. So it's not just air pollution, of course. Our transport systems are largely dysfunctional in as much as they encourage physical inactivity, or they make it difficult to undertake adequate levels of physical activity. And nearly 4 million deaths a year have been linked to physical inactivity. It's a risk factor for diabetes, heart disease, and many other conditions. And then the food system, as we've already heard, is also causing a lot of ill health right now. And the Lancet Commission a few years ago reminded us that if we could move towards what they called a planetary health diet, which was a much more emphasis on adequate consumption of fruit, vegetables, other plant-based foods, we could potentially prevent over 10 million deaths annually by shifting to these healthier diets over coming decades. And also, of course, reduce the environmental impact of the food system, which is the major driver of biodiversity loss, of course, but also contributes very substantially to climate change. Now, this slide has already been essentially described because it really just reminds us of the inequalities in emissions. And it shows us that the top 10% of emitters are responsible for nearly 50% of emissions. But I want to make an additional point here, and that is that those people who have been responsible for very little of the emissions are also the most vulnerable to the effects of climate change, but they're also those people who suffer from inadequate health care. So when thinking about the future, we need to think about how to scale up universal access to affordable health care. But remember that the healthcare system itself contributes 4 to 5% of global greenhouse gas emissions. And about 60% of those emissions come from the supply chain. So we can't just have a healthcare system which is based on the one we have in highly developed countries today. I'm not sure they are highly developed, but high-income countries anyway. In the States, for example, it's nearly 9% of greenhouse gas emissions. So we have to have a different conceptualization of health. Health has to be built in to our societal priorities, not just through the healthcare system, but also through policies that can promote and support health and also take us towards a more sustainable future. So very, very briefly, our work in the Pathfinder review synthesized evidence from as many countries as we could find. We had to harmonize the evidence, which took a long, long time. We had to screen about 7,000 papers, something of that order. And I think one of the challenges is that science, the synthesis of scientific results is becoming increasingly important for the future. But we're confronted with a massive increase in the sheer volume of scientific evidence, and we can't keep pace with it. So our review is already out of date. And we need to develop different approaches, probably using machine learning, which we're exploring at the moment, to rapidly synthesize research evidence as it comes on stream. Now, most of the evidence we found was modeled rather than implemented. What we're really interested in is implementation. What happens when you actually implement change on the ground? Most of the evidence is from modeling studies, which are important in as much as they give us the direction for the future. And I won't go into detail this slide, but essentially what we found was there were 200 unique actions which reduced greenhouse gas emissions and improved health, where there were metrics measuring both greenhouse gas emissions and health outcomes. Some of these affected multiple outcomes, so that's why there are more than that on this slide. And you can see that they range from buildings, cook stoves, multi-sectoral policies, electricity, food and agriculture, transportation, and so on, as you'd expect. There are some sectors that are underrepresented, like waste, for example. We know that there are benefits from different waste disposal approaches, water, sanitation, and so on. They were underrepresented in the literature that we found. And so we created these two metrics, one of which we called mitigation intensity, which gives you the number of tons of CO2 equivalent which can be mitigated by a particular policy in a particular location, a particular context. So you probably can't see the detail here, but essentially this is the kilotons, the thousands of tons in terms of per 100,000 of population. And on the right, you can see the health co-benefit intensity, which is the health benefit you get from mitigating along this pathway. And without going into detail, the first thing that strikes you is a lot of variation. So a lot of it depends on context. What is the background level of air pollution? What is the background level of greenhouse gas emissions? What diets are people consuming? What is their background level of physical activity? But the good news story is that there are big reductions in greenhouse gas emissions from many of these strategies. And through a judicious combination of different strategies, we can achieve big health benefits as well as big reductions in greenhouse gas emissions. So a lot of it's about tailoring the right strategy to the right context. And if you want to know more about the detail, there's this climate and health evidence bank that we've created, which is open access, which you can look at the modeling studies, the evidence that we've brought together, and also the case studies of implemented action. And I want to just spend my concluding minutes on just describing a few case studies, because I think case studies of implemented actions are often much more compelling than the kind of rather abstract figures from modeling studies. And so this is one of them that we found. This is in the US from renewable portfolio standards, transitioning from coal and natural gas to renewables in the US. And it documented nearly 150 megatons of CO2 emissions avoided in 2015 alone due to an increase in solar and wind power. And that was estimated to prevent between 3,000 and 13,000 premature deaths. So that's a nice example of a win-win strategy. We also know that cook stoves are very important as a public health measure. Clean cook stoves, over 2 billion people cook using these inefficient and poorly ventilated stoves. They cause probably about 3 million deaths annually. They're variable estimates, but certainly many millions of deaths. So the best way to tackle this, of course, is provide clean electricity from renewable sources. That's not always feasible at the moment. So you can also use clean fuels such as ethanol and LPG as a transition to reduce household air pollution. And this is a major killer for women and children, including a risk factor for childhood pneumonia. Also reduces a lot of black carbon, of course, and it contributes to deforestation. In cities, there are many, many strategies that can be enacted. This is a nice case study from Buenos Aires in Argentina, the More Bikes, Less Emissions program in Buenos Aires, and they estimated 12,000 tons of CO2 emissions avoided through an increase in bicycle trips, and also improvements in health, reductions in people killed on the road. They created safe cycling and walking. So these active transport strategies can improve health through increased physical activity, reduced injuries, and of course reduced air pollution as well. And what you need is integrated strategies, integrate active travel with public transport. In Australia, we came across a very interesting study where they randomized low-income homes in Victoria and Australia, and they upgraded them, but using insulation. They led to warmer homes, reduced breathlessness, as people reported. They also reported better mental health, reduced healthcare costs. In fact, the costs of this retrofitting actually it was paid for very much by reduction in healthcare costs, and also, as you can see, reductions in CO2 equivalents. And then nature-based solutions, we've heard something about those as well, and this is just another example. Urban trees can bring health benefits. So this study documented the ecosystem services of 170 million urban trees in California, and showing the reductions in greenhouse gas emissions, but also as they store CO2, they reduced air pollution. There's an increased deposition of some pollutants on the leaves of trees. But you have to plant the right trees, because if you plant trees that are allergenic, you can make people's health worse. And some trees produce volatile organic compounds, which are precursors of tropospheric ozone, which of course is a greenhouse gas and also damages health. So you have to know what you're doing, but with the right policies, you can achieve benefits. And then finally, this is a nice study that was done in Indonesia. An NGO called Health in Harmony consulted the local community to find out why they were deforesting. And the answer came back to them. In many cases, they were deforesting to pay for healthcare costs because they couldn't access affordable healthcare. So what they did was to implement affordable healthcare to these forest communities and documented improvements in infant mortality, better healthcare coverage, 90% fewer households relying on logging income. So you can't just prohibit deforestation, you have to understand what's driving it. Poor people don't necessarily want to deforest, but they have to in order to survive. So this is just a nice example of a win-win strategy, providing healthcare, can also reduce deforestation, protect nature, and also reduce carbon emissions. And then finally, the healthcare, the dietary changes that are needed, moving particularly in high animal product consuming populations to more plant-forward diets, as they're often called. Here it's difficult to find case studies of how diets have actually been changed by policies, but we do know that there are many people living in the population today that are actually already consuming diets that are healthy and low emission. And this is one study led by my colleague Pauline Shielbeek, studying over 500,000 people in the UK, and showed that those people that had high or intermediate adherence to dietary recommendations, the so-called Eat Well diet, had a 7% reduced risk of mortality from heart disease, and also 30% lower dietary greenhouse gas emissions. Much of this from methane, of course, which ties in very well with the previous presentation. So we're also potentially able to reduce tropospheric ozone, methane as well, through this dietary change. So you can't avoid talking about the food system if you want to talk about climate change and methane. So finally, in conclusion, let me leave you with a positive message that there is a lot that we can do to reduce the risk of dangerous climate change and also capitalize on these near-term co-benefits of living in a more sustainable economy. We have to think about health as more at the center of our social policy and economic policy. It can't just be addressed by the healthcare system itself. We need systems thinking and implementation science in order to accelerate this transformational change that we've already heard about in the discussion. But importantly, we also need annual reporting, because there's a lot of greenwashing about. A lot of people are saying that they're doing great work, and I'm sure they are, but it's not always easy to find the evidence for that. So we actually need transparency, we need good metrics, we need measurements of greenhouse gas emissions, measurements of health exposures or benefits, and we need regular reporting. We need to support mutual learning, because none of us have got all the answers. The only way we can go forward is by learning from each other and sharing the opportunities that are there to learn from each other. And I think communicating positive messages is really important. We also know that just telling people that we're on a catastrophic road to hell is not going to change behavior. And what we need is to create a positive vision of a kind of society in a world in which people actually want to live, and show them the way in which we can get there, improving health, stabilizing the climate, protecting nature. Thank you very much.